think often when you have people like yourselves contributing to public debate, it is really, really, really important. If COVID is with us for a long period of time, I think our political system faces a challenge, because if I had 4 economists in front of us, you would all have different views as you have now, and the political system and thus democracy would dictate which course of action which we would take. In my view, Ireland has taken a very balanced view. We've not gone for the zero COVID, although I don't think we're too far from it, nor have we gone for the open element either. I suppose my query is that as politicians, we all have to assess the advice that's coming before us. And so my question is, what do you believe, if, for example, on austerity, austerity is a way of reducing public debt, but it has terrible consequences and often loses public support. So if we were to pursue a zero COVID strategy, would it be inevitable that you would lose public support and that there will be unintended consequences?
Do you want to direct that question to anybody in particular?
Perhaps to Thomas and Sam, yeah.
So I'm happy to talk about that. Unfortunately, the countries like New York and Milan and Wuhan, of course, that were hit by this when they had no restrictions, suffered huge, not just healthcare problems, but also huge economic damage. So it is the case that a lot of the economic damage is inevitable by the virus. Of course, the economic restrictions, especially on things like cruise liners and the aircraft industry and hospitality and tourist industry in Ireland, has been very bad, and it's affected different parts of our economy differently. Some things, like I alluded to earlier, like pharmaceuticals, are booming along, and supermarkets and deliveries and internet shopping. So this is really difficult to have a very divisive situation where some of us in the economy are sort of doing fine and others are really losing their jobs and suffering catastrophic loss of their wealth and assets and businesses, and trying to keep social cohesion in that K-shaped recovery, as they said in the Financial Times, is really difficult. And yet, unless we can keep the coordinated action of 5 million people voluntary together, we won't come through this successfully. So I do think we're in a potentially socially fragmented and politically fragmented future, and trying to hold us together as one nation acting is difficult. In Sweden, obviously, maybe there's some countries have more, what would you say, trust in authority, trust in public health experts, trust in government. We in Ireland, we're basically independent folk, at least where I come from in Monaghan. The border area is full of people who, in their own head, believe that they know everything and can do what they like. And lots of people will identify with that. So trying to get coordinated action is really challenging, and balancing the economy. I've been talking about this from January, actually, saying that the economic impact of this would be huge. So I recognise this is the biggest challenge, in my view, that the state has faced in 100 years since the Civil War, that we're only getting over now 100 years later. So there's no doubt the governance challenges here are still colossal and something that nobody imagined, in the February election.
Thanks, Sam. Perhaps I could ask a second question to Professor Schaffer. There has been an uptick in the 14-day rate, really, in a number of European countries, and yet when you look at the restrictions in those countries, they vary greatly in terms of what is permitted. I suppose the question that a lot of people are asking is, why has that 14-day increased over the last 2 or 3 weeks? Is it a seasonal and a weather factor, or is it to do with the increased activity around holidays that might have happened in August? Why are we seeing the same pattern across Europe that has different restrictions?
So I can maybe answer that from 2 sides, because as you probably noticed, I'm German, so I know a little bit about what's happening in Germany as well. And as you stated correctly, that in a lot of European countries, the rates have come up over the last 14 days. And this is mostly due to kind of really household parties, social gatherings, family get-togethers, and where people don't adhere to social distancing. And that's where I think we have to be really, really careful as a society, because I think for young people, COVID-19 is quite an abstract term, and they feel quite deprived of their social interactions. And I think if we want to have buy-in from the whole of society to go through this difficult time, I think we really have to change our approach, and we have to become more open and more transparent, because otherwise we will just lose buy-in, especially from the younger generations, because they just had enough. They're tired of this. And on the other hand side, then we have the elderly and the vulnerable who are terrified. So society seems to be diverging into two directions here, and I think that's where we really have to try to change tax a little bit to try to bring society together again. But in answer to your question, yes, the rising rates over the last 14 days, as far as I can see, is mostly due to like gatherings, family gatherings, parties, where people don't adhere to social distancing, and that's maybe where we have to look closer at as well, how we can deal with that.
Could we hear
Thank
from
you,
Dr.
Professor.
Gillespie?